Here we go again. Ontario is going into its third state of emergency while a second stay-at-home order kicks in at midnight. And teachers and essential workers in Toronto and Peel hot zones will start getting vaccines. It is a turnaround for a government that seemed pushed into a corner before it changed course.
I can't stress this enough. Things are extremely serious right now, and I'm extremely concerned.
The warnings have been growing for weeks that variants would drive a devastating third wave. Last week, the health sciences table warned the variants were deadlier and making younger people sicker and called for a stay-at-home order. 6 days later, when COVID ICU cases are now over 500 and hospitals pushed well over capacity, the government pivoted.
Why did you wait, and are you listening to science or aren't you?
Well, I'm listening to health and science, and I listen to Dr. Williams. I want to emphasize that we acted immediately as soon as I found out that the ICU capacity and on top of that, the variant was moving rapidly.
A stay-at-home order is part of the new government action. As of next week, all education staff, from teachers to childcare workers who work or live in Toronto and Peel hotspot neighborhoods, can start getting vaccinated. And planning is only now underway to send mobile units into high-risk settings to vaccinate anyone over 18 in large workplaces and priority neighborhoods.
We need to get the vaccines where they will have the greatest impact as quickly as possible.
Under the new restrictions that begin at midnight, big box stores will only be able to sell essential goods. Non-essential retailers must do curbside pickup only. Schools and daycares will remain open unless ordered closed by medical officers of health. And people are once again being told to stay home.
Let me be clear. These measures will be enforced.
The government, though, acknowledges it doesn't have enough police to crack down on everyone, so they are asking for the public's cooperation, with the Premier promising things will get better.
I'm expecting that we will be able to have 40% of Ontario adults vaccinated by the end of the 4-week stay-at-home order. And that's when things start to change dramatically in our favor.
So, in summary, if you live in an identified high-risk area in Toronto and Peel and you're over 18, you qualify for a vaccination. And you don't have to book it through the provincial website. You will get your vaccine through community outreach and mobile units. And here's a chilling point. The government said today it has not finalized an indemnification order for doctors yet, meaning it's looking at giving doctors legal protection if they don't have enough resources to treat all patients and have to choose who to treat based on best odds of survival.